Everybody should be careful to avoid coronavirus disease. For most people who are young and healthy, symptoms will be mild and brief, but type 2 diabetes can make COVID-19 deadly. At any age, someone with diabetes must be very careful. If flu-like symptoms come on, anyone with diabetes should lower sugar intake, stay well hydrated, and monitor blood sugar more than usual. I'm Dr. James Hurd, a physician specializing in preventive behavioral medicine and cardiovascular rehabilitation. Viral diseases have been infecting people for hundreds, possibly thousands of years, probably as long as people and animals have been around each other. Infections like influenza infect both animals and people. Over the years, we've found medications to treat the flu and developed vaccines to build immunity against severe disease. Once infected by a virus, we become immune to it and somewhat immune to disease from similar viruses. When an infection gradually disappears from people, infections persist and keep adapting in animals. Eventually, a variation develops that can pass from animals to people and from person to person. Then it spreads from individuals to groups, then populations, eventually spreading wherever people travel. Respiratory coronavirus disease has existed in animals and people for more than 40 years. Several varieties cause illnesses such as the common cold. Other varieties cause influenza. During the last 40 years, we've developed medications to treat respiratory virus diseases in general and vaccines to prevent influenza. In 2019, in China, a new version developed in bats and spread to people. This variety of coronavirus disease is more dangerous than the flu. It's new. There's nothing we're certain is effective to treat it or protect us against it. All we can do is cut down how fast it spreads. We do know that COVID-19 spreads from each infected person to at least 2 or 3 others. We also know that 80% of infected people had only minor disease and recovered in 2 or 3 weeks. However, 20% had severe disease and 1 or 2% died. In comparison, influenza only spreads from 1 infected person to fewer than 2 others. Also, it is deadly for fewer than 1 in 1,000 of those who are infected. Influenza is particularly dangerous combined with type 2 diabetes. Severity of influenza requiring hospitalization is 6 times greater in patients with type 2 diabetes than those without diabetes. The greatest danger from this new coronavirus disease is the severity of illness. So far in the U.S., approximately 10% of patients with COVID-19 required hospitalization. 2.5% required intensive care, and 1% died. This severity of illness is more than 10 times greater than the severity of influenza. The Center for Disease Control lists diabetes as one of the chronic illnesses that increase the chance of developing serious complications of COVID-19. Severity of this illness in China was substantially greater for patients who had type 2 diabetes than those without chronic disease. The table shows that most of the patients admitted to hospital had either hypertension, diabetes, or heart disease. Approximately 20% of them had diabetes, and about half of those with diabetes did not survive. The natural response to infections involves immunity cells. These are cells located in blood, organs, and tissues. The metabolism of these cells is just as complicated as cells in any other system. They depend on sugar, fat, and protein for energy to operate, just like function in all other cells. Insulin is especially important. Insulin resistance from poorly controlled diabetes damages immune function, just like it damages function of muscle, liver, heart, brain, and nerves. The time to repair the immune system is before viral infection. Repairing insulin resistance requires physical, nutritional, and behavioral fitness. Health fitness takes time, planning, and consistent day-by-day action. So far, it looks like type 2 diabetes slightly increases risk for COVID-19. What is certain is that diabetes increases its severity of illness. Insulin resistance is much greater than usual. If flu-like symptoms occur, any sugar or excess calories raises blood sugar levels 2 or 3 times more than usual. Before you get sick, make a plan. Enter the phone numbers of your doctors and healthcare team into your cell phone. Make a list of medications and doses you can read and spell for anyone you're talking to over the phone. Put together a supply of simple carbs like regular soda, orange juice, sugar tablets, if you are too ill to eat and your blood sugar falls too low. Get extra refills on your prescriptions so you don't have to leave the house. Make sure you always have enough insulin for the week ahead. Collect up extra supplies like rubbing alcohol and soap to wash your hands. Bring home enough household items and groceries so that you can stay at home without going out for a week or two. Take extra everyday precautions. Avoid close contact with people who are sick. Clean your hands often. Wash your hands with soap and water for at least 20 seconds. Use a hand sanitizer. Avoid contacting high-touch surfaces in public places. Avoid touching your face, nose, or eyes. Avoid crowds. Avoid all non-essential travel. Watch for emergency warning signs. Develop difficulty breathing or shortness of breath, feeling a persistent pain or pressure in the chest, any development of confusion or inability to arouse, and a change in color of lips or face. If you do get sick, know what to do. Drink lots of fluids. Check your blood sugar several times during both day and night. If your blood sugar is more than 240 milligrams per deciliter when measured 30 or 60 minutes apart, call your doctor's office. If you would like to participate in our type 2 diabetes recovery program, you should sign up. Click on the link in the video description. After you sign up, you'll be asked to register and supply a few points of data concerning date of birth, smoking history, height, weight, blood sugar, and daily injections of insulin. We will call you and establish secure communication links for reporting and reviewing results, starting with fasting blood sugar, basal heart rate, and body weight. Then I will call you to ask about your medical history with type 2 diabetes. Also, we will discuss details of your goals and objectives for recovery from diabetes. In addition, we will set up an action plan for recovery. There is no charge for this service as long as you continue to report on a regular schedule and continue to work towards recovery from diabetes. We are dedicated to helping people recover from type 2 diabetes and maintain good health using telehealth technology.